Hey guys, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com, and you can get a hold of me at jason@intricateartseminars.com if you have any questions about this stuff. So what I wanted to talk to you guys about today is dry needling to be used in conjunction with psychotherapy treatment, right? So this is an area that I'm really fascinated in. I played Division I ice hockey in college. I've always been around people, sports psychologists, physiologists when I was playing hockey, right? And mental health is such a hugely important part of sports, of life in general, right? And it's one of the most poorly treated set of medical impairments that we have in the country, right? I would say, if I had to pick one off the top of my head, men's health is by far the worst treated. Mental health is right up there, right? So what makes absolutely zero neurophysiologic sense is that physical treatment is not incorporated into almost all mental health treatment, right? Obviously, there's some people that won't be applicable for that, but in general, right, it makes absolutely no sense. So it's like stepping over a pot of gold bars to pick up like a piece of copper on the ground, right? We're totally disregarding a lot of simple things that we know about the human body. One of the major reasons for that is the pharmaceutical companies do not want any type of cheap, effective care out there, because they would rather give people pills that only treat the symptoms and have them taking those pills for life, right? Much more profitable for them. So sympathetic autonomic hyperactivity, and I've spoken with numerous psychiatrists, medical doctors, psychiatrists, psychotherapists about this, right? The vast majority of mental health patients have sympathetic hyperactivity, right? You can easily make the case that almost all physical therapy patients are also mental health patients, right? Any physical therapist knows that you feel like a psychologist a lot of the time when you're working, right? So the more pathologic tissue that we have throughout our body for whatever reason, whether you're consciously aware of it or not, right? So that means tight muscles, trigger points, little knots, aggravations, right? The more of that we have throughout our body, the more our sympathetic autonomic nervous system is going to become elevated. That's just the body's natural response to mental stress, strain, or trauma is sympathetic hyperactivity, right? So we don't need to know all the specific mechanisms of action by which dry needling works, and we certainly don't, right? We just have a very rudimentary understanding of how it all works, but we do know a couple of things that we're almost for certain about, right? And one of them is that dry needling, the overall effect of dry needling, almost regardless of how you do it, especially if you add joint manipulation into your dry needling treatment following dry needling, the overall result is sympathetic autonomic depression and parasympathetic autonomic elevation compared to baseline, right? So if you specifically add in needles targeting the parasympathetic nervous system to depress sympathetics and elevate parasympathetics, which will lead the autonomic nervous system to homeostasis, you're going to have much better outcomes with any type of other mental health treatment that's already going on, right? So if our sympathetics are hyperactive, our brain cannot process mental and physical trauma and cannot heal the mind and body properly, right? So you guys have all heard about people saying that like emotions can get held in tissues, and whether that's specifically true or it's just some other mechanism, that if you have a traumatic experience and you have a concomitant physical pathology with that experience, like an accident or something like that, if that physical pathology is not addressed, the mental pathology is never going to fully go away, right? You may get better, but you're not going to get as good as you could get, right? So dry needling and spinal manipulation and joint manipulation are two safe, effective, extremely potent tools to depress sympathetic autonomic hyperactivity, right? So we know that chronic sympathetic hyperactivity disrupts serotonin levels, it disrupts our gut microbiome, which overall produces 95% by weight of the serotonin that we have in our body, right? Sympathetic hyperactivity disrupts dopamine levels, right? So regardless of how dry needling regulates the autonomic nervous system, right? We don't even need to get into that. We know basically for a fact, especially if you add in vagus nerve stimulation, that Dry needling depresses sympathetics and elevates parasympathetics, which nudges the autonomic nervous system towards homeostasis, right? So all other medicines will work better for people if they have a more homeostatic autonomic nervous system. Their treatment sessions are going to go better. They're going to be able to mentally process psychological treatment better. Their body's going to help the mind heal, right? There's no way to separate the body and the mind as far as really anything goes. Our body doesn't work without our brain functioning and vice versa, right? So you have to address physical pathology in conjunction with mental health treatment if you want to have the chance of maximum success, right? It makes zero sense why this wouldn't be a widespread treatment, aside from the fact that people don't want it to be out there, right? It's really, really effective. Vagus nerve stimulation, electrical auricular vagus nerve stimulation, right? Vagus nerve stimulation is already FDA approved, and I would have to double check if the ear stimulation or if it's the surgical implant. Medical doctors will surgically implant a little metal cuff around the vagus nerve, typically the left vagus nerve, right? And the patient will come into the clinic every once in a while and get it stimulated. But a recent meta-analysis that I just read looking at a comparison between the surgical procedure and the needle procedure in the ear showed no real change in the efficacy of treatment. Both treatments were efficacious, right? So vagus nerve stimulation is currently FDA approved for anxiety, epilepsy, depression. They're looking at it for chronic pain, eating disorders, irritable bowel syndrome, all sorts of stuff, right? So we already know that vagus nerve stimulation is very powerful potential treatment for mental health therapy. So why isn't vagus nerve stimulation included in all psychological therapy, right? Again, it's cheap, easy, and effective. I see extremely awesome results with a huge number of my patients. We have incredible emotional responses from people in classes on a weekly basis almost, right? People will just have these big emotional releases and they'll feel much, much better afterwards without any specific psychological treatment going with it, right? So imagine if you could combine specific good psychological treatment with what I'm already seeing without specifically going after psychiatric medicine, right? That's not part of physical therapy, but just by reducing sympathetic hyperactivity, you're going to make the mind and body more homeostatic, allow them to function better. Your hormones, your neuromodulators will be in more regular concentrations, and current mental health treatment or future mental health treatment will be much more effective. If anybody has any questions about anything, let me know. Thanks.